my name's Sabrina. I'm a young ambassador for the Brain Tumour charity. Today I will be speaking with Dr Paul Brennan, a neurosurgeon and researcher in Edinburgh, and we'll be speaking about the impact that COVID-19 is having on the brain tumour community. Hi Dr Brennan, I hope you're well.
Hi, how you doing?
Hi.
Thank you for taking the time to speak with us today. We truly appreciate it with how extremely busy you must be at the moment.
It's not too bad. Yeah, it's always busy.
Firstly, could you please tell us a bit about the impact that the coronavirus is having on patients in Edinburgh?
As you can imagine, it's having a big impact in both how we work and in the sorts of work we're doing. So there have been big changes in the hospital in Edinburgh, as I'm sure there have been in hospitals all over the country, trying to prioritise the hospital for people with COVID-19. And so it's meant a big change in the way that we admit patients and the way that the different resources in the hospital are allocated. So it feels a very different place to work. And then that has an impact in the decisions we're making about patients. So we're still seeing lots of patients with brain tumours, we're still running clinics, we're still having multidisciplinary meetings, we're still operating, but we're doing all of that in a very different environment from what we were doing 3 weeks ago.
And how exactly are you carrying out those multidisciplinary team meetings? That must be quite a challenge for you at the moment.
We're doing them online. So there's various different conference apps. So we've been running those, I think, for 3 weeks now. They work very well because actually it's quite difficult to get everyone together on the same day at the same time to have these sorts of meetings. So in some ways, this is one of those innovations. There's lots of innovations that have come through the last 2-3 weeks, which might actually make the delivery of healthcare better. So we're all meeting. NHS Lothian uses Microsoft Teams, but there's lots of different ways of doing it. And so we can still discuss the cases. We review all the brain images just as we would do when we were all sitting together in person.
Oh, that's brilliant. And has your team been affected by all of this? Have you had any staff redeployed in an attempt to tackle the challenge of the coronavirus?
Yeah, I mean the wider team. A lot of nurses within the hospital are sort of being reallocated to the high intensity parts of the hospital, so where patients are getting admitted, and obviously there's lots of patients in the hospital actually with COVID-19. There's lots of new roles for people to do, so things that you might not necessarily think about. So people need to wear masks when they treat patients, and someone needs to teach us all how to fit the masks. There's lots more phone calls to be made because we're now doing consultations over the telephone and stuff. So there's lots of people working in different roles within the hospital. But the core jobs are all still getting done. The other problem is obviously that some people can get unwell. The staff can get unwell as well as patients. And so that has an effect on how many people are around and the days in which they're around. So patients and their families might notice a difference in availability, and there's all these different factors playing into that.
Yeah, I can imagine that must be really difficult. Have you had many members of your team unfortunately fall ill themselves?
So people are self-isolating, as if anyone in your family gets sick, then you end up self-isolating. So, and that doesn't mean that they've got coronavirus. It just means we've got this level of precaution around coughs and temperatures and things. So there's people all over the health service, or as there are more generally, sort of dipping in and out of availability because of that. But on the whole, it's really impressive how things are getting done. So even when people are self-isolating, they can still, I could be self-isolating now, right? I could still have a call with you as long as I'm not sort of sweating profusely and coughing all over the place. But so yeah, it's people are being very resilient and very resourceful in how they carry on doing jobs, even if we can't be in the hospital physically as often as we were before. And in some ways, it's probably best for us not to be in the hospital all the time because we can get sick. So we don't necessarily want to be exposing ourselves to that risk all the time if we can do work remotely.
Do you have any advice for the brain tumour community that they may find useful at this really challenging time?
The thing that I think I would find really challenging is how many different opinions are being expressed. There's all the advice about who should be shielding and who should be self-isolating, and why my scan's late, and all these things that are happening. It's not. There's not a big rule book that everyone's following at the moment. A lot of these decisions are sort of evolving, and I think the key thing is to just stay in touch. If you've got a query or you think something's not right or changing, then you've obviously got people you can contact within the tumour teams to ask about those things. But the other thing is be really reassured that there's a huge number of people advocating for our brain tumour patients. So we're changing the way we're doing things, but we're not changing fundamentally the way that we deliver care. So things might get done in a slightly different order, or the timing of scans, or even the timing of surgery might be different than it would have been, a month ago, 2 months ago. But we will still deliver the care that needs to be delivered. So, I mean, it's hard. I would find it impossible being at home with all that level of uncertainty. But I think, ask people questions if you have questions, and be reassured that there's lots of people working hard to make this happen. So.
And what insight can you give us for patients that have had their treatments delayed?
I think it's an important question that we're very conscious of at the moment, because we were all aware that this COVID-19 situation was coming, but there was I think for us, as the same for many other people, there was a reasonably sudden change in the availability of resources, because the reallocation of anaesthetists and surgical facilities to intensive care, and also this sort of emerging awareness of the risk that people who had an existing cancer had if they were exposed to COVID-19. And so we were planning, we had this awareness that this might change and that the circumstances might change, but they did change reasonably quickly. So I think there will be some people who were right at the point of having surgery, and where that decision's now changed. And I can understand that would be very difficult. But all these decisions are what we did in Edinburgh is we then took everyone back through the multidisciplinary meeting. So, but a very focused meeting. So we said, right, these are the people who are all scheduled for surgery. And we rationalised who could wait and who couldn't wait. We're not in the interest of exposing anyone to harm. Yeah. So our hope is that COVID-19 will resolve over the next month or 6 weeks, and then a lot of those operations, which we've basically just put back for 2-3 months, we can pick up. And I don't think those patients are going to come to harm, because these are often operations that we might have been following patients up for several months or even years, and then it's just got to the point where we said we'll do an operation. But the caveat is always, if that patient does deteriorate over that period of observation, then they then become a priority. So we're not trying to stop operating. What we're trying to do is reduce the chance that we expose patients or members of staff to risk, either because of COVID-19 or because of everyone's doing all these different jobs. So we're still operating. So as far as possible, I hope that what is the risk of delaying stuff, I hope we can keep that to as little as possible being the answer. Invariably, but there'll be some people for whom that risk is more present for them. But we're certainly doing everything we can to try and make sure the people who really need something doing right now get an operation done. But anyone who can wait, even if it's just a few weeks, will wait. But we keep that under review. I mean, in Edinburgh, we've certainly we're doing no elective surgery at all, but we are still doing tumour surgery. So, and in the last couple of weeks since these circumstances changed, we've done probably more tumour surgery than we would have necessarily done in a normal 2-week period. So, and I'm sure that's replicated over the whole country. So we're prioritising the people who are most in need. It's just, I think, globally, the amount of surgery that getting done has gone down. But the patients who need surgery will hopefully get surgery.
That's very reassuring to hear that they're being dealt with in the safest and the best way possible. And I know that the patients who find themselves in that situation will also have their minds put at ease by hearing that as well.
Yeah, obviously, I mean, there's lots of different centres doing cancer care, and they've all got their own pressures and their own solutions to dealing with the changing circumstances. So I think the key thing is just for people to, if they're uncertain why a decision's been made about them or what that decision is, then just ask the question. because these are personal decisions. They're not. Certainly, I would hope it's not happening anyway. But we're asking the question about every individual: what's the best thing for them? We're not saying take all these patients and move them over to there. So people should be able to get the feedback they need about why decisions changed or what that means for them, and what happens if something else happens. It's not just a closed sort of discussion. It's a sort of an ongoing thing, which hopefully that people can have some reassurance about.
Thank you. That's really insightful. Once again, we greatly appreciate you speaking to us, Dr. Brennan, and thank you also to you and your team for all that you're doing at this really difficult time. It's greatly appreciated. Hope you all stay safe and take care.